Georgia Krein, I'm so happy to have you here with me today. Welcome to Coach Cary and Finding Your Higher Consciousness podcast.
Thank you. I'm glad
Ab-
to be here.
Absolutely. I'm really excited to learn about your story, your special gifts, your journey, and how you help people. I think it's truly amazing some of the things I've already learned about you from the interview that I listened to for the pre-interview, and I'm really excited to just bring this to the community and to people that hopefully they can really resonate with them, and it can give them, an ability to heal, ability to think a little bit differently, another perspective, and just really
Mhm.
hopefully pique some curiosity and some questions and be able to address with these beautiful people that are watching.
I don't think I'm as special as other people do, but that's okay.
Well, I think
Um,
we're all unique and we all have special gifts, and so that's what it's about. It's just bringing about what your perspective and how you've lived your life and how you're healing and helping people. It truly is special.
mhm.
So,
So I've been a nurse since 1986.
okay,
A long time.
yeah.
And then in 2011, I graduated from the nurse practitioner program. So my background as far as the medical world is kind of vast because that's a lot of years. I started out in psych, which I really didn't want because I come from a crazy family and it wasn't where I wanted to be. But when I graduated, um, most nurses were only hired part-time so they didn't have to pay benefits. Um, and this was offered to me at full time. So I took it and then I left it. And then I moved on to child and adolescent psych specifically. And I did that for 7 years. I worked physical rehab for 10 years. I've worked home health and hospice just for a short period of time during a transition. And then I worked the ICU for 7 years in flight nursing. When
Oh,
I became,
wow.
yeah, then I moved to skilled nursing facilities, which is also a rehab for longer term patients. Um, and I was always calling the doctor and say, "Can you give me an order for this? Can you give me an order for that?" And then I just decided to cut out the middleman, so I went back to school. And then I took over that long-term care facility when I graduated. And now I'm at opiate use disorder, and I have been here for 8 years.
How's that been?
I love my job. I
Good.
honestly have to say that I have never had a job that I didn't love. How's
Mm,
that? You learn something everywhere you go. And even though I'm there 7 years, 8 years, 10 years, um, it never gets stagnant. It's just things change,
hmm
you know, it's time to move on, time to do something different, things like that, or you're introduced to something different.
Well, it's interesting that it sounds like your entire work experience, at least going back to the mid 80s, is serving others.
Exactly. Yes.
So thank you for that.
You're welcome.
Yeah, that's amazing. A lot of people don't have that ability, so pat yourself on the back for that. Georgia, so it's I understand too that you have some special talents, special gifts, abilities maybe that some have covered up by the trauma in life and don't know how to tap into it all. Could you talk about maybe some of the special gifts that you have that you use in your everyday work?
So I am a medium. I have a lot of clairs. I mean,
Okay.
clairvoyant, Clara, whatever.
Mhm.
I can taste things by looking at them, believe it or not.
Okay.
And so I don't know why I eat, you know, I should be full already, but yeah, I can know what it's going to taste like before I eat it. Um, I also have what I call the knowing. I can look at people and know they're sick. I see yellow skin before they actually have yellow skin.
Mm-hmm.
So I know jaundice is setting in. I used to think that nobody was watching or nobody cared or nobody bothered to notice, when in reality, I was the only one that saw it. So working in a skilled nursing facility, be like, "Oh, he's got pneumonia." And I can even tell you it's in his right lobe, without even pulling out a stethoscope. But I know if I order that X-ray today, it's going to be fine. It's going to be negative. It's going to be normal. If I wait 3 days and order that X-ray and just keep an eye on them, it's going to be positive. So I would have like a sit and wait list and check on them every day until I knew it was time to get that X-ray. I don't know. I used to think, so I was born with spirits around me. Um, they've been with me all my life. Like I get messages, almost some kind of warning sometimes, to
Hmm.
get out of the way, move over, whatever, like there's danger coming. So I've been prognostic also, um, which has helped us to, and like I said, kind of come from a crazy home. Um, it kept people safe.
Well, for real quick, for people that don't know what prognostic means, could you explain that real quick?
That something's going to happen before it happens. For
Okay.
instance, I can see a plane crash before it happens, um, but I couldn't tell you, and it's kind of my fault because I don't ask my guides. But I can tell you that the plane crashed. It crashed into the water, and whether it was a big city or whatever. But I can't tell you what airline it is or what flight number it is.
Hmm.
When I went to Sedona to work with practitioners, she said, you got to ask your guides to give you more information. I was like, why? Because I would end up on the FBI's most wanted list. No, I'll pass. I know it'd be nice if you could, but that's the reality of the situation.
Yeah.
Anyway, I've known it since I was a small child. I never questioned it. Um, how do you know if it's spirits talking to you or whether it's just in your mind? I go, well, at first I didn't. I mean, as a child I did because I didn't have any other reason to doubt it, right?
Yeah. Yeah, of
But
course.
as we get older and get into a lot of stress or things going on in life or having kids, going to school, all those things, we kind of we block everything. Um, so for me, one day it was just kind of a awakening for me to say, I am missing something in my life and I know what it is. So I just booked a flight to Sedona, booked a whole array of practitioners to work with, and went down there for 4 days, and it was exhausting. It
And
was
when
ex
was this? When was this?
probably, gosh, it must have been like 10 years ago.
Okay.
Um, and they validated everything that I already knew, but that validation can be very strong.
Hmm.
So, how did you know you were a psychic or whatever? I just said, I just did. I said, I feel like everybody is born with some abilities, but they're told that's a fake friend. You don't really see that person, quit talking to fake people, whatever, until the child believes it. It's kind of like people that are in a low vibration all the time have so much negativity pumped into their brain all their lives, so that it's like it's like the root of a tree, and those roots are negative roots that are just stuck there and
Hmm.
occupying space, so you can't let anything positive in. All right, so it's kind of the same way when they're telling you that you don't have gifts or that you're making it up or that person's not real, things like that. So I tell them, you all do. I really feel like a lot of people with mental health diagnoses, I'm not really sure they're schizophrenic and I'm not really sure they're bipolar. There are a lot of bipolar out there.
Yeah.
Um, and the patients that I work with, they did their psych testing under the influence of drugs. So, you know, I don't know. So I just ask them, well, what do you think you can do? All right, tell me what you think when I show you this or whatever.
Hmm.
And they ask questions. They love this stuff, they do. They just want to be special. I mean, they want people to see them as something besides an opiate use disorder.
Yeah, of course.
And it's hard because the same
Mm.
doctors that were passing out opiates left and right are the same ones that are slamming them now, So it's like it's a bad thing. A lot of stigma.
Yeah, definitely is. Was there ever a point when you were young, like under 10 years old, where you had like a point where you were could have gone a different direction and not embraced your gifts?
I don't think so.
Was that
They were just
never a question for you?
no, never. I never questioned it. I thought everyone had the same abilities I had, But then
Hmm.
I thought everybody's house was as crazy as ours was too. So I didn't question. I really didn't. My biggest thing was when I decided like I am missing something in my life and then kind of tuned into this is what I'm missing. I'm not utilizing the gifts I was given. I probably was, but not like it should have been used. I mean, as far as like um, trusting my gut, going with my gut, like don't let someone talk you out of it, it is what it is. But it was very validating to go to Sedona. It's a magical place. I don't know if you've ever
Mm.
been.
No, I haven't not been there.
Oh, it is so beautiful there. You can feel the energy when you drive into that town.
Hmm.
Yeah, and it was my first trip all by myself. I was just like walking around, looking at all the sites. They have, um, what are they called? They have four vortexes there. Um, do you know what they are? Do you know what a vortex is?
I've heard some people talk about it. Why don't you go ahead and explain?
So it's like when the horizontal and vertical lines on what do I want to say, a map or a globe, they meet together at these certain spots. And the trees are all very strange at those sites. They're all twisted and they just look different than any tree
Huh.
ever. So there's so many signs there. There is a place called Church of the Cross that is built on one of those vortexes.
Yeah.
Um, and that's the only one you can get to without hiking. So you better like hiking if you go
Oh, yeah.
there to see the vortexes.
Well, and I've heard that a lot of spiritual places in past history are built on those sites, from what I understand.
Yeah, yeah, that's where the Church of the Cross is. I think that's why
Yeah.
it's built just like that. And it's like it's surrounded by red sand and clay. It's all the way around the city. So it's just like this little fortress kind of place inside. So yeah, it was good.
When you're receiving information about someone or something, is it a feeling? Is it a voice? Is it a like, can you explain that to us, like how that is? Because I know it's different for many people.
And for me, it comes from so many different senses because I have all the different abilities. So, to give you an example, I had a patient that just all of a sudden his son started talking to me while I was cooking supper one night. And I didn't even know he had a son that committed suicide because he's not even from North Dakota. Um, by the end of the conversation, I knew what his name was. Um, but I don't very often see the person's face. I don't see them physically. I might see shapes, and I can definitely see gestures. They show me gestures all the time, like stomping their feet, or I will get up and show the well, my client, not my patients, but someone I'm talking to. I would put my hands on my hips and stomp my foot, and they would know exactly that this was the person that was coming through for them. So I get a lot of gestures. When I get when I hear things, it's my voice.
Okay.
But I think the only way to explain it is if it's coming from the front of my head, it's me thinking. But if it's coming from the back of my head and there's a difference, no. Well, maybe they have, I don't know, but I just give them things to try. Nobody learns the same way. I read books. I love John Edwards, by the way. I'm not the politician John Edwards, but
Okay.
over John Edwards. Um, I love to watch him, and he's another person that you very seldom hear a negative thing from him. I will get up and show, well, my client, not my patients, but
Welcome to Coach Cary's podcast. I am so excited for episode number 2 to invite Georgia Krein. Where was it?
Doesn't work.
Oh, we're gonna have to find the other one. Welcome to Coach Cary's podcast. I'm so excited for episode 2, and I'm very, very happy to be welcoming Georgia Krein. Bum, 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 bum. Bum, 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 bum. Bum, 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 bum. Mhm. Hello. Hi, Georgia.
Just,
I can hear you.
you can't see me though.
No, I think you just need to turn your camera on. Well,
There we
hello.
go. Hello. How are you?
I'm doing amazing. How are you today?
Very, very busy.
Busy?
I'm still charging from the jail, so yeah, it's been
Okay.
busy.
Gotcha. Well, thank you for taking the time today.
No problem. This is my cup of tea. I love the whole high vibration theories.
Good. Yeah, I call them practices, theories. Yeah, there are
Yeah,
ways to
that's
live your life. There's lots of different ways for sure.
practices is a good way to put it though, because you really do have to practice.
Yeah, well, anything we want to be good at in this life, I think does take a little bit of practice.
Yes. And you have to be surrounded by positive people.
That makes a huge difference for sure.
And
So,
with what I do, that's not always possible.
no, that's not. Georgia, how do you want me to introduce you?
Um,
I mean, I
you
was thinking, like
you can
Georgia,
just say,
go ahead.
sorry,
No, go
you
ahead.
can just say Georgia Krein, nurse practitioner working in opiate use disorder.
Okay. And you
And it,
did you start that clinic? Is that right?
no, it's a corporation.
It's a corporation. Okay.
It's a corporation. I'm a nurse practitioner. I'm not a counselor. But I started a high vibration group in our clinic because I just thought, wow, like if they could get in a higher vibration, it's easier for them to say no to drugs.
Yeah,
But if they stuck in a low vibration, chances are they're going to join in when it's offered. So I like to, I should put this where my face is so I can look like I'm talking to you. Um, but so that was kind of where that all started, and it took off really well.
that's awesome. Okay, well, I'm ready to start. I think I hit the record button. Let me make
Yeah,
sure.
it said it was
Yeah,
recording.
I
Signed
don't
in.
I've made that mistake before.
Yeah.
So
Well,
I'm trying to
it
learn.
probably was better the second time.
We didn't do a second one, although we might. But it was a really good one. I was super bummed, but oh well, the universe speaks sometimes, and that's just the way it's supposed to be. So,
Yeah, it
okay.
is.
Well, Georgia Krein, I'm so happy to have you here with me today. Welcome to Coach Cary and Finding Your Higher Consciousness podcast.
Thank you. I'm glad
Ab-
to be here.
Absolutely. I'm really excited to learn about your story, your special gifts, your journey, and how you help people. I think it's truly amazing some of the things I've already learned about you from the interview that I listened to for the pre-interview, and I'm really excited to just bring this to the community and to people that hopefully they can really resonate with them, and it can give them, an ability to heal, ability to think a little bit differently, another perspective, and just really
Mhm.
hopefully pique some curiosity and some questions and be able to address with these beautiful people that are watching. So
So I
with
don't, go ahead.
no, go ahead, Georgia.
I don't think I'm as special as other people do, but that's okay.
Well, I think
Um,
we're all unique and we all have special gifts, and so that's what it's about. It's just bringing about what your perspective and how you've lived your life and how you're healing and helping people. It truly is special.
Hmm.
So,
So I've been a nurse since 1986,
okay.
a long time.
Yeah.
And then in 2011, I graduated from the nurse practitioner program. So my background as far as the medical world is kind of vast because that's a lot of years. I started out in psych, which I really didn't want because I come from a crazy family and it wasn't where I wanted to be. But when I graduated, um, most nurses were only hired part-time, so they didn't have to pay benefits. Um, and this was offered to me at full time, so I took it. And then I left it. And then I moved on to child and adolescent psych specifically. And I did that for 7 years. I worked physical rehab for 10 years. I've worked home health and hospice just for a short period of time during a transition. And then I worked the ICU for 7 years in flight nursing. When
Oh,
I became,
wow.
yeah, then I moved to skilled nursing facilities, which is also a rehab for longer term patients. Um, and, I was always calling the doctor and say, can you give me an order for this? Can you give me an order for that? And then I just decided to cut out the middleman. So I went back to school. And then I took over that long-term care facility when I graduated. And now I'm at opiate use disorder and I have been here for 8 years.
How's that been?
I love my job. I
Good.
honestly have to say that I have never had a job that I didn't love. How's
Mm,
that? You learn something everywhere you go. And even though I'm there 7 years, 8 years, 10 years, um, it never gets stagnant. It's just things change,
hmm
you know, it's time to move on, time to do something different, things like that, or you're introduced to something different.
Well, it's interesting that it sounds like your entire work experience, at least going back to the mid 80s, is serving others.
Exactly. Yes.
So thank you for that.
You're welcome.
Yeah, that's amazing. A lot of people don't have that ability. So pat yourself on the back for that.
Mm. Yeah, me, if the bloodier, the gorier, the better. I'm bad. I'm so bad.
So,
All right.
Georgia, so I understand too that you have some special talents, special gifts, abilities maybe that some have covered up by the trauma in life and don't know how to tap into it all. Could you talk about maybe some of the special gifts that you have that you use in your everyday work?
So I am a medium. I have a lot of Claras. I mean,
Okay.
clairvoyant, Clara, whatever.
Mhm.
I can taste things by looking at them, believe it or not.
Okay.
And so I don't know why I eat, you know, I should be full already, but yeah, I can know what it's going to taste like before I eat it.
Hmm.
Um, I also have what I call the knowing. I can look at people and know they're sick. I see yellow skin before they actually have yellow skin.
Mm-hmm.
So I know jaundice is setting in. I used to think that nobody was watching or nobody cared or nobody bothered to notice, when in reality, I was the only one that saw it. So working in a skilled nursing facility, be like, oh, he's got pneumonia. And I can even tell you it's in his right lobe, without even pulling out a stethoscope. But I know if I order that X-ray today, it's going to be fine. It's going to be negative. It's going to be normal. If I wait 3 days and order that X-ray and just keep an eye on them, it's going to be positive. So I would have like a sit and wait list and check on them every day until I knew it was time to get that X-ray. Um, I don't know. I used to think so. I was born with spirits around me. Um, they've been with me all my life. Like I get messages, almost some kind of warning sometimes, to
Mm-hmm.
get out of the way, move over, whatever, like there's danger coming. So I've been prognostic also, um, which has helped us to, like I said, I come from a crazy home. um, it kept people safe.
Well, for real quick, for people that don't know what prognostic means, could you explain that real quick?
That you know something's going to happen before it happens. For
Okay.
instance, I can see a plane crash before it happens, um, but I couldn't tell you, and it's kind of my fault because I don't ask my guides. But I can tell you that the plane crashed. It crashed into the water, and whether it was a big city or whatever. But I can't tell you what airline it is or what flight number it is.
Mm-hmm.
When I went to Sedona to work with practitioners, she said, you got to ask your guides to give you more information. I was like, why? Because I would end up on the FBI's most wanted list because Delta Flight 1335 fell into the ocean. Yeah, no, I'll pass. I know it'd be nice if you could, but that's the reality of the situation.
Yeah.
Um, anyway, I've known it since I was a small child. I never questioned it. Um, how do you know if it's spirits talking to you or whether it's just in your mind? I go, well, at first I didn't. I mean, as a child I did because I didn't have any other reason to doubt it, right?
Yeah. Yeah, of course.
But as we get older and get into a lot of stress or things going on in life or having kids, going to school, all those things, we kind of we block everything. Um, so for me, one day it was just kind of a awakening for me to say, I am missing something in my life and I know what it is. So I just booked a flight to Sedona, booked a whole array of practitioners to work with, and went down there for 4 days, and it was exhausting. It
And
was
when
ex
was this? When was this?
probably, gosh, it must have been like 10 years ago.
Okay.
Um, and they validated everything that I already knew, but that validation can be very strong.
Mm-hmm.
So when my patients ask me, like, how did you know you were a psychic or whatever? I just said, I just did. I said, I feel like everybody is born with some abilities, but they're told that's a fake friend. You don't really see that person. Quit talking to fake people, whatever, until the child believes it. It's kind of like people that are in a low vibration all the time have so much negativity pumped into their brain all their lives, so that it's like it's like the root of a tree, and those roots are negative roots that are just stuck there and
Mm-hmm.
occupying space, so you can't let anything positive in. All right, so it's kind of the same way when they're telling you that you don't have gifts or that you're making it up or that person's not real, things like that. So I tell them, you all do. I really feel like a lot of people with mental health diagnoses, I'm not really sure they're schizophrenic and I'm not really sure they're bipolar. There are a lot of bipolar out there.
Yeah.
Um, and the patients that I work with, they did their psych testing under the influence of drugs. So, you know, I don't know. So I just ask them, well, what do you think you can do? All right, tell me what you think when I show you this or whatever.
Mm-hmm.
And they ask questions. They love this stuff, they do. They just want to be special. I mean, they want people to see them as something besides an opiate use disorder.
Yeah, of course.
And it's hard because the same
Mm.
doctors that were passing out opiates left and right are the same ones that are slamming them now. So it's like it's a bad thing. A lot of stigma.
Yeah, definitely is. Was there ever a point when you were young, like under 10 years old, where you had like a point where could have gone a different direction and not embraced your gifts?
I don't think so.
Was that
They were just
never a question for you?
no, never. I never questioned it. I thought everyone had the same abilities I had. But then
Hmm.
I thought everybody's house was as crazy as ours was too. So I didn't question. I really didn't. My biggest thing was when I decided, like, I am missing something in my life and then kind of tuned into this is what I'm missing. You know, I'm not utilizing the gifts I was given. I probably was, but not like it should have been used. I mean, as far as like um, you know, trusting my gut, going with my gut, you know, like don't let someone talk you out of it. You know, it is what it is. But it was very validating to go to Sedona. It's a magical place. I don't know if you've ever
Mm.
been.
No, I haven't. Not been there.
Oh, it is so beautiful there. You can feel the energy when you drive into that town.
Hmm.
Yeah, and it was my first trip all by myself. I was just like walking around, looking at all the sites. You know, they have, um, what are they called? They have four vortexes there. Um, do you know what they are? Do you know what a vortex is?
I've heard some people talk about it. Why don't you go ahead and explain?
So it's like when the horizontal and vertical lines on a map or a globe, they meet together at these certain spots. And the trees are all very strange at those sites. They're all twisted and they just look different than any tree
Huh.
ever. So there's so many signs there. There is a place called Church of the Cross that is built on one of those vortexes.
Yeah.
Um, and that's the only one you can get to without hiking. So you better like hiking if you go
Oh, yeah.
there to see the vortexes.
Well, and I've heard that a lot of spiritual places in past history are built on those sites, from what I understand.
Yeah, yeah, that's where the Church of the Cross is. I think that's why
Yeah.
it's built just like that. And it's like in this, it's surrounded by red sand and clay. It's all the way around the city. So it's just like this little fortress kind of place inside. So yeah, it was good.
When you're receiving information about someone or something, is that just, is it a feeling? Is it a voice? Is it a, like, can you explain that to us, like how that is? Because I know it's different for many people.
And you know, for me, it comes from so many different senses because I have all the different abilities. So, you know, to give you an example, I had a patient that just all of a sudden his son started talking to me while I was cooking supper one night, and I didn't even know he had a son. He's not even from North Dakota. Um, by the end of the conversation, I knew what his name was. Um, but I don't very often see the person's face. I don't see them physically. I might see shapes, and I can definitely see gestures. They show me gestures all the time, like stomping their feet, or, you know, I will get up and show the, well, my client, someone I'm talking to, I would put my hands on my hips and stomp my foot, and they would know exactly that this was the person that was coming through for them. So I get a lot of gestures. When I get, you know, when I hear things, it's my voice.
Okay.
But I think the only way to explain it is if it's coming from the front of my head, it's me thinking. But if it's coming from the back of my head, and there's a difference if you pay attention to where they're coming from, if it's coming from the back of my head, it's spirit. Um, I consider myself a spiritual psychic because I don't get bad things. The messages I get are always to help someone heal physically or mentally.
Hmm.
But I never get, you know, I belong to some psychic groups that they say they're attacked by spirits or something like that. And they probably were, I don't know, you know. But that doesn't happen to me, you know. But so it makes me kind of wonder, what are your spirit guides doing? You know, I mean, maybe you better let those suckers go back. Um, but yeah. So I mean, I get it from all kinds of different ways. Like I was getting my teeth cleaned and the girl doing the cleaning, you know, that's the perfect place to get messages because you can't talk. Um, you know, your mouth is full. And she knew my abilities because the one who had cleaned my teeth before, she was just on maternity leave. So this other girl was there, but I told her she was pregnant and she was having a Taurus boy. And she goes, no, I'm not pregnant. The next time I went in to get my teeth cleaned, which I have to do every 3 months, she actually was pregnant when I told her she was pregnant, and she actually had a Taurus boy. So this girl was saying, I heard you read so and so. And so anyway, after the cleaning, I said, all right, you want a reading, don't you? And she said, yeah. I go, okay, your grandma's here. And I explained her hat and her pants that she wore and that she lived in the country and she would just throw on these khaki pants, work pants, and this goofy hat that looked like Gilligan's Island. And she actually pulled the picture up of her grandma who had passed away. And she was wearing that hat.
Wow.
Yeah, so it was, those kind of things they're kind of cool.
Yeah,
Um,
so cool. So
mhm,
cool. Have you
yeah.
ever, has anybody ever asked you to teach them how to do this?
No. Well, maybe they have, I don't know, but I just give them things to try. Nobody learns the same way. I read books. I love John Edwards, by the way. I'm not the politician John Edwards, but
Okay.
over John Edwards. Um, I love to watch him, and he's another person that you very seldom hear a negative thing from him. It's
hmm
usually very positive. I saw one time where he warned a mom about a substance abuse problem that she needed to address
hmm
in intervention. And guesses are, chances are he was probably going to overdose if they didn't intervene. Um, and he didn't say it like that, but he did give the warning because it was just really strong for him. Otherwise, he gives just very emotional, healing kind of messages. So um, I like watching him.
That's fantastic. So your journey of being a nurse practitioner and being in that field for so long, and then you said that the information that you get and you receive is to help people, right?
Yes.
It parallels what you do in this world in a physical sense too. That's why I just find it very interesting. Like I see such a parallel there for you, that you
Yeah.
receive information to help people, and that's what you do for your living. So why wouldn't you receive that information to help people? I don't know.
Right,
It just
right.
it connects up nicely.
It probably is why I chose to go. I mean, it was part of my path.
hmm
And my patients sometimes ask me, "Well, can you change your path?" I said, "Of course you can." But what happens is you get stuck on a path that might not be great, might be traumatic, bad marriage, whatever. But you stay on that path because you're familiar with the stress. You know how to
hmm
deal with that stressor. Stepping off that path and going a different direction takes more energy. Um, and so you just got to take baby steps. You just got to
Yes.
step in a direction and follow it. It's not the yellow brick road. It can be changed. Um,
Yes.
and so, what I had them doing in my group that I was doing. So first of all, it was all my patients that get admitted here, I always give them an assignment the day they're admitted, and that is, I don't care if it's on toilet paper, that's what I tell them, or a paper towel or scraps of paper. I want you to write down 3 good things you did today.
Yeah.
Um, and I had one girl in my group that her self-esteem was so low that she didn't see herself doing anything good. So we had to really take baby steps. And I said, look, if you go down the grocery store aisle and you smile at an elderly lady and she smiles back, you could have just made her day. She could be at
Mm.
home, isolated, doesn't get out very much, family doesn't visit, and you actually noticed her by smiling at her. That's a good thing.
Yeah.
Or holding the door open when somebody's hands are full. That's a good thing. She goes, that's just being polite. But yeah, no, not everybody would do that. So it is a good thing you did today. So don't forget the little stuff. And they all had little tiny pocket journals they could write down if they were triggered. Um, and they could write down something good they did before they forget. Um, and it was just kind of fun because they would bring those journals back and want to talk about them. So
hmm
yeah, it was baby steps, but you know, I want I wanted to teach them to breathe. Nobody knows how to breathe. Um, I am very much into crystals. I have crystals
Okay.
all over my office.
All
Here, let me
right.
show you. Let me show you.
Yes. Let's show us, please show us.
I gotta see what I'm showing here. Okay,
Yes.
so there's the short little camera, but there you can
Yeah.
see the amethyst
Uh-huh. And is that your art?
behind me.
Yeah.
Yes,
Yeah.
that's what keeps me in a high vibration.
Yes, I know you are an artist, so we're definitely going to talk about that too, but I just wanted to touch on that real quick.
Yeah, so and then I have a ton of gemstones. Let me see here. Right
Okay,
up
yeah.
there.
Nice.
So my office is very zen.
That's
Um,
I wanted to ask you, you are such a light for others and you're working in an industry that's very challenging for people, right? And I know I've been clean off of prescription drugs and alcohol since 2019. So I experienced that struggle and I know what a challenge it is. How are you able to show up every day and give everything you have, but still protect a little bit of yourself, and still have the energy so you can come the next day and you cannot get taken off track by, working in such a really challenging field.
you know, I'm kind of elderly myself, and um, but I still like to learn. I
Okay.
mean, I am learning all the time. I live on Reels, on the Facebook Reels. I just live for
Okay.
them.
Okay.
Um, One thing is there's so much art on there, and it's just fascinating what people are doing out there. And I love color. So, I mean, it's just like I could do it for hours. The other thing is, and it's funny that when I talk to um, Courtney, I didn't know if I should say her name or not, but when I was
No,
talking
it's
to
fine.
Courtney,
Yeah. Yeah.
um, the very next day, all of these vibration things started showing up on my reels.
Hmm.
And it was like, whoa. Anyway, so I used to listen to Mandy Morris all the time. I love Mandy Morris, and I have her books. Um, and I also follow a doctor in long-term recovery that works with substance abuse disorders. And she is just so fascinating to listen to. You learn so much from her.
Okay.
Uh, do you know who I'm talking about?
No, I do not know who you're talking about, but I can see
Oh,
how that would be very advantageous.
yes, she just wears at the drop of a hat, things like that. And she goes, well, you know what? Someone says maybe you should clean up your language in there or something. And she was like, I believe that, being me is being authentic. And, if I want people to understand something, it's not going to be always professional the way it's put out there. I mean, I drop the F-bomb to my patients, believe it or not, but I do it um, like by using an analogy. There's a purpose for that. I'm not
You're
just around
supporting
using
them,
the F
clearly.
word, but so sometimes you got to get into their world. You got to meet them where they're at, and sometimes I piss them off on purpose because I know they need to get pissed off to get better. Like I had a couple that was readmitted 6 or 7 times, and on the seventh time, I said, "All right, just stop right there at my door." I was like, "Same shit, different month. Walk the walk, then we'll talk," and sent them right out the door. Um, and so a week later, he came back in and he put his hands on my desk and looked me in the eye and said, "I'll bet you didn't think we were going to dose every day this week, and I'll bet you thought I was going to be late for this appointment." And I said, "Jake, you can prove me wrong every single day because then you win and I win." And they are still in our program. They are still sober. But it was
Good.
like I had to challenge him. Um, so again, that's where I get that feeling. I know this patient, and I know the whole. I mean, I've seen it over and over again. So let's just piss him off. That's what it's going to take. That's what we're going to do.
Hmm.
Again, the knowing. You know what I mean? Like I know what's going to
Yeah.
work, what's not going to work.
Yeah. That's really special. I mean, that gives you, I mean, an advantage over other people that are in a similar line of work because you have a something extra. You have something where you can relate to those people in not a educational way, but in a really direct spiritual way.
Right. So you asked me, how do I stay
Yeah.
positive in my job? You know what? My patients, to give you an example, my patients put me in a high vibration. And
Okay.
we get to see just one little thing, you know, when I have a patient who's come in here for a year and never says boo, you know, it's like pulling teeth to get him to say anything. And then all of a sudden, you know, he's just in here, blah, 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 blah. I was like, holy cow, like that's awesome. So that helps my vibration, you know. And honestly, there are days, especially like if you don't feel good and you come in to the office like, oh God, I do not want to see that person again. You know what I mean? Like, here we go again. And then they walk through your door and it's like a switch is flipped in me. Like all of a sudden I notice something that we can talk about, you know, to get them to talk.
Mm-hmm.
So when I was dreading it, and then by the end of it, you know, like some people, I remember saying to the nurses one time, that guy's an odd duck, but I really like him because there's just something about him that is really likable, even though he's, you know, full of shit, you know? That's the only way I can put it. I
Yeah.
used I used to have a bullshit button on my desk. Corporate maybe take it away. Um, But they got so used to it that sometimes they'd hit the button themselves. I didn't have to push it. All I have to do is give them that look, the mom look, I call it. And then they just hit the button because they are full of shit. Um, so yeah, I mean, I don't know. I say I have 400 children. Um, and I don't mean that in a negative way.
No,
But
not at all.
you know, people in addiction, or you know, we don't even like the word addiction anymore. It's kind of got a
Yeah.
negative connotation, but people with substance abuse disorders, they already have a very low self-esteem, carry around a lot of shame and guilt, 10 times more than anybody else. So, I don't like to use that term, but it's hard because I've heard it all my life.
Yeah.
Addiction.
Yeah.
Um, all right, where was I going with this? I don't even remember what we were talking about. Um,
Well, I had asked you a minute ago just about how you protect your own well-being, and I think you just kind of
yeah,
spun off of that. Do you feel like your art is definitely one way that you help support yourself? And
yes, and this is something again that I brought up to my group and the people that I work with, is that we as children all knew what brought up our vibration. What'd you do? You know, I'll ask my patients now, what did you do? What do you do that makes you happy? Um, and then they just say nothing or they can't think of anything. So I started listing things off. Um, and ironically, the other day it was the guy that said, I like to cook. I go, well, do you cook? He goes, yeah, I'm a single dad. I go, do you enjoy it? He said, yeah, I'd cook all day if I could. I said, do you know that they have a culinary art school online? And he said, they do? He said he went to culinary art school and got into drugs 2 months before he graduated. I go, there you go. So now he's signing up for the culinary art school so he can finish his degree.
that's
Um,
fantastic.
and it's what makes him happy. So why wouldn't you do that? You could do it for the rest of your
Mhm.
life and get paid for it. So I'm always asking them. So I have one wall out in the lobby that is all client work. They did the work. I have a huge, I swear this girl only stands 5 foot tall and she made like a 3.5 foot round tree of life.
Okay.
She's a welder. So it's hanging on the wall. You know, like they're so happy to bring their stuff in and show it off. So
Hmm.
um, I encourage it all the time. So anyway, the other thing is I have to cut the cords once in a while, you know, if I'm having a bad day.
Hmm.
Depending on my day, sometimes I'm ripping them out like anchors, you know. depending on like what's happening. Okay, that sucker's got to come out. I don't do it enough though, honestly. I don't do it enough. It's something that I have to get better at practicing. Matter of fact, the other day I sent alarm to go off every hour at 5 minutes to the hour. So I get up and stretch and use the bathroom
Mm-hmm.
if I need to because I put it off. Get something to drink, cut the cords. I got 5 minutes. I'm just gonna sit here and breathe.
Yes.
Um, because if you're in a low vibration, you're not helping anybody. You
Mm-hmm.
know, I don't believe that you can be effective at anything you do in a low vibration.
Yeah.
Um, you're not going to create change, that's for sure. People always say when they walk in my office, it's like so energetic. I actually have selenite above my door. Do you know what selenite is?
I've heard of it. Does it probably
It,
increase some sort
it's
of,
a crystal that clears away negativity.
yeah.
It clears away negative things. So it clears them coming in and it clears them going out.
What is it? Is it celestite?
Selenite.
Yeah, stellanite. Yeah, celestite is a different one. That one I am familiar with.
Yeah. So they walk through there. I have one guy that comes in here every time he doses, he comes in, steps in my door, out of my door, in my door, out of my door, just stuff. Even though I gave him his own to
It's
take
like
home with.
bathe me in the light of the rock, please.
Yes, yes. And then I have a blue calcite. Let me get this. Blue calcite. With stones, it's really about the color more than the stone, but it's a huge piece, and it's for calming.
Okay.
So when they're stressed out or really anxious, I don't even tell them what this rock does. I just tell them to put their hands on it, close their eyes, and take some deep breaths, and then tell me how they feel. And it's always the same. I feel just like they're grounded or they're
Mm-hmm.
or calm.
Yeah.
Um, so is it a placebo? I don't know. I didn't tell them what it was for. Or was it the
Yeah.
breathing? Doesn't really matter
No.
because the outcome was good.
Mm-hmm.
So a
Absolutely.
lot of times I have people come in here just to put their hands on the rock and breathe,
That's
which is
awesome.
fine too.
Do you practice any like traditional spirituality? Are you a Christian? You don't have to answer if you don't want. I'm just
No,
curious.
no, I'm okay with this because I've said it out loud many times. I consider myself a believer.
Okay.
I've seen the other side. I can't cry at a funeral when somebody's really sick and they die. I cannot cry at a funeral because I know where they're at,
Mm-hmm.
and it's a beautiful place. And
Yeah.
no, I mean, like I'm happy for them. I'm not sad. I'm sad for the family, but I just don't. I don't know. It's very. Oh, I don't want to say. Um, it's a great gift to have. I mean, it's great to know, to have that feeling of joy when they pass away and go to heaven rather than, mourning.
Yeah, absolutely. What would you say to people that are like, well, if you're a believer, why do you have those rocks? Why do you have, you know what I mean? Because in the Bible, there's certain things that say about false idols and magic this and numbers that, and there's certain things. So I'm just curious on what you would
Right.
say to someone.
So, okay. So I said I'm a believer.
Yeah,
I know I'm going to heaven. I believe in God, obviously,
yeah,
in the universe. Um, I don't believe in church. And the
okay.
reason I don't believe in church is because the Bible says, thou shalt not interpret the word of God. And to me, every religion is an interpretation of the word of God. Otherwise, they would need all these denominations. So, that's just my own feeling. And I don't feel
Hmm.
like I need to sign a contract to
Yeah.
pay a church for something that I have in my heart every day. So yeah, that's my answer to
Okay.
religion. I
That's
usually
fair.
tell them, I usually say, well, no, I'm not going to go to church because the walls would fall in and innocent people would die. It's been so long since I've been to a church, but it's not, I mean, funerals and weddings, that's kind of it. But I mean, however, whatever anybody needs to heal, go for it. I mean,
Hmm.
I know a lot of people that are in recovery that turn their life over to God. Good for you, you know? Um, but when they say they turn their life over to God, it's like I go to church now. Um,
That's there's
like,
more
okay.
to it than that.
Yeah, I had a staff worker tell me one time, how can you call yourself a Christian when you live in sin? Because I've been with the same guy for 26 years, but I don't feel like I don't follow rules. I'm not very good rule. I'm not, I just don't know.
Same.
Um, but anyway, she goes, how can you call yourself a Christian if you live in sin? And I go, really? How many angels have you seen? And
Well, we
I never heard another word from her. She did ever say
or
that.
not to mention, you don't ever sin. Come on.
Yeah,
We're all
that's just,
humans. We're all humans.
nobody needs to throw a stone. Yeah, I mean,
Yeah.
like,
Yeah.
that's in the Bible too.
I
So
know. I
read
know.
that verse. Did you read that verse, girl?
I know
Um,
exactly. The reason I asked you that question, Georgia, is because I've experienced something recently with a really good friend, who's very, very religious, and he's part of the reason why I accepted Jesus back into my life,
mhm.
and he's cast out some judgments on me for some things that's been very painful. So I was just curious on how you dealt with that.
I guess, just like I did with my stone here, maybe it's a placebo, maybe it's the breathing. I don't care. Like, if it gets the results for better outcomes, I'm fine with it. Believe what you want to believe, you know? If it helps, I hand out pieces of that, of a blue calcite to my patients. They have them in their pockets, they have them in their bras. Um, because they remember what it felt like to just hold it and breathe. So if you've gone through the recovery process, you know the anxiety you have when that all starts. Um, and now they just know to just put their hand in their pocket and hold that stone and breathe. So
Wow.
it gets them through a panic attack, then it gets them
Hmm.
through a panic attack. So I guess if you read in the Bible though, they had all kinds of ointments and all
I
this kind of.
know. Yeah.
So again, it's interpretation, and I think that the intent of what you're doing can make it evil or good,
Yes.
it depends on what you're
Uh-huh.
thinking. So
100%.
yeah.
100%.
So I mean, like if you're thinking that it's evil, you probably have an evil mind, and turn it around. Go
Yeah.
ahead.
Definitely. Let's talk about the clinic you work at. Let's talk about some of the patients. I want to talk about, tell me like a few of the groups that you have. Do you just have one group that you guys do like multiple times a day? Do you have different
There's
like
different groups all week long. Okay, so first of
okay.
all, we are a medication assisted treatment program.
Okay.
When I started here 8 years ago, there were 63 patients,
Okay.
and I probably admitted over 1,000 since then because they're in and out. Um, Sometimes they're in and out 6 or 7 times, like I said before, but we
That's
never
tough,
turn
man.
anybody away because, um, except for violence. And the reason that is because if we lock the door on them, they could die,
Hmm.
you know? And my thought is every time they take a step in the door can be the first day of sobriety for the rest of their life. So I'm not closing that door. You know, Nobody ever changes in a day. It
No.
just doesn't happen.
No.
Um, I feel like everybody has some kind of addiction out there, whether it's coffee, whether it's soda, whether it's sugar, whether it's food in general,
It can be anything. It can be
It can
anything.
be. And so many people will stop like the drugs or stop alcohol and then turn to gambling. I mean, it's an addictive personality. Um, and so they're going to go a different direction. And I warn my patients about that all the time. All
Hmm.
right. So in our clinic, we do Suboxone. You've probably heard of that. It's an
Hmm.
opioid,
Yeah.
a synthetic opiate. And then we do methadone, which is an opiate. It's a 24-hour opiate once we get them on a dose that where they feel normal. They're normal, where they're not having withdrawal or being sick from one dose to the next. I explain it to them like this. The medication is just a Band-Aid, okay? It's
Yeah.
just a Band-Aid. It's like building the foundation of a house so you can stand there without being sick
Hmm.
Looking over your shoulder so you can actually focus on how you got here to begin with. All
Yeah.
right. So, you hear people all the time slamming things like Suboxone, methadone. Well, they're not sober if they're using Suboxone or methadone or whatever. You know what? They have to learn to live sober to get sober. It is hard to learn to live sober. And it's very lonely. It's a lonely place to be. And that doctor that I was telling you about that I followed, I think she described it in a really good way to where I probably used her saying 20 times in the last week, maybe, that people with substance abuse disorders, so the normal person has dopamine that drops every time they do something to make them happy,
Hmm.
little increase in dopamine, like say, 10 balls falling from the sky and catching them. When you're doing substances over and over and over again, those are big dopamine drops. So your body thinks it's so happy um, that when they get sober um, and the dopamine slows down, what they're craving is that rush.
Hmm.
And the brain is saying, give it to me, give it to me, give it to me. Um, anyway, so we have Suboxone, we have methadone, we have Sublocade, which is a shot. It's an injection of Suboxone that lasts 30 days, sometimes longer. Um, we started treating hepatitis C in our buildings because most of them have hepatitis C, especially if
Yeah.
they're heavy drug users.
Right.
Um, and so I think we have 100% success rate in eradicating Hep C. And part of the reason for that is that they're really close to us. They're our family. I mean, like we're their family because they don't really have family. They've cut them off. Um, anyway, they trust us and we give them their medication with their methadone or with their Suboxone. So we know that they are taking their pills,
Hmm.
and doing it the right way. So we've
Yeah.
had a 100% success rate. We've probably eradicated in the last year maybe 80 patients. Um, Sometimes they drop off as soon as they get their Hep C treated, but that's okay. They know where we're at. They know the medication works and they may come back. So it's fine. I admit directly from the jail um, on telehealth. Somebody that goes in, they're doing screening now for opiate use. And one guy I saw today that I admitted right there at the jail because I was making rounds today. Um, he lied about using opiates, and he's so sick
Mm.
that he finally said, "Help!"
Yeah.
Um, because people hang themselves in jail. They would rather hang themselves than go through the withdrawal.
Yeah.
Um, or people die from a seizure, or, it really just depends. And so finally, the government is looking at that and saying, okay, every county jail in the United States is going to have a medication assisted treatment program, whether the jail likes it or not.
Hmm.
Because, what, we have so many people in jail for drugs or alcohol or substances of any kind where they don't really need to be isolated anymore. Okay, we already proved that doesn't work. Um, but they need treatment.
Yeah.
So, that's what they got to do. That's what they got to do. So we treat Hep C here. Um, there's a huge rise in syphilis in the United States, and I've seen several cases of that this year. Um, we don't treat that yet, but it's coming. We usually send them out to the primary care, which they don't have primary care because they don't like the way they're treated.
Hmm.
So it's hard to get these guys to go to the doctor. They're just like, please, will you just treat my tooth pain? Something like that. I do a lot of primary care, by the way, because I'm not going to send them out with an abscess that could go to their brain. So,
Hmm.
I try to discourage it, but, it is what it is.
So as you guys treat these folks, then do you have like group type of environment with them, or is it just one to one?
So they have counselors.
No, they have
They're
counselors.
a
Okay.
counselor. They have to see a counselor at least once a month.
Okay.
And then the counselors do groups 3 or 4 times a week. Um, and when I was doing the energy and vibration group, I made it so that I could send them out invitations to join us online because we serve the better half of Western North Dakota all the
Okay.
way to Montana. So we have patients that drive 2 hours to get here, sometimes longer. So by offering them to be involved online, at least they're getting online. I mean, they're actually participating. I feel like I always felt like it wasn't as strong a feeling as being in the group. I mean, like you can feel the energy. Um, like 20 people would walk out of here, and number one, they never wanted to quit after an hour. And
Hmm.
then number two, they'd go out to the other lobby while people are dosing. People are like, "What were you guys doing in there?" Everybody's like so happy, like the energy was just incredible. And I miss that so much. I do. I miss it so much. But I got so busy, I just couldn't do it anymore.
Hmm.
I couldn't guarantee that we would have the group. Um, but they always wanted to align the chakra first, and they always wanted to breathe first. When I first brought up the chakra, I was like, oh, I don't know about this. I didn't want them to like get scared off from some woo-woo stuff. But oh my gosh, they
Yeah,
eat it. This day and age, they eat that stuff up.
no
Um,
question. No question.
yeah. So I actually did paintings, small
Okay.
paintings of the chakra with the if you're aligned, if you're not aligned on each one of them, so they could see it and they could see the color. So I had a black background, like say with a red burst of color um, for the root chakra, and one for each different chakra, so they could actually see it as we were going through and clearing the chakra. Um,
That's really cool. I would like to do that. That sounds really cool.
yeah, it was good. Some people, you know what? It was so funny is that they started calling each other out in the lobby, so I would have them doing energy checks. I know. Do you know what that is? So during the day, you really should be checking in your energy level. Like, you know, maybe you have to do it every 2 hours until you are more aware of what's going around you. Or maybe you're going to do it twice a day, whatever works for you in your schedule. But you ask yourself, okay, what kind of mood am I in? Is my energy high or is my energy low? And then, if it's low, you have to ask yourself, why is it low? And then what do I need to do to get my energy level back up? So I would have patients sitting in the lobby, and one patient would tell another patient in the group, I think you need to do an energy check.
That's
So
great.
they got the lingo.
I
It was
love
like
that. So
they
good.
didn't even, it wouldn't offend that person either. It would make that person smile and think, oh, yeah, maybe I do. Um, I don't know. It's just been so infectious.
Yeah,
Um,
I feel that. I mean, I had a huge smile there when you were telling me that.
Yeah, this is our patients really do love us. It's the best group I've worked with in 8 years. You kind of have bad apples here and there, but um, the patients, I make a point of telling them on admission that we are non-judgmental. We don't expect you to be perfect, and I'm not perfect. I tell them I can swear like a trucker. I'm not perfect.
Yeah.
Um, and we don't expect you to be perfect, and nobody here is judging you. There's a couple of analogies that I use on admission to help them understand. One of them is the foundation of a house, like I told you.
Hmm.
Um, one of them is that I'm not an opiate use disorder. Okay, I'm not, but I like my food. All right. So if I go on a diet for 2 months and I lose 20 pounds and then I eat a piece of cheesecake, I can say, fuck it and eat the whole cake, or I can knock myself on the head and get back on the bandwagon. So
Yeah.
they can correlate that with the drug use. And I tell them they can't fail unless they quit coming.
Yeah.
And also, all the guilt and shame that they carry around, they have so much shit on their shoulders coming in here that if something bad happens, they make a bad decision, then come in and tell us about it. Not so we can take away your birthday, beat you up, or throw you out of the clinic,
Yeah.
but so we can talk about how to avoid that in the future, possibly.
Hmm.
Um, so they're very comfortable, coming here from day one. And everybody greets them. There's someone's talking to them every time they walk in the clinic. Everybody knows their name. Our nurse knows their dog's names. She's kind of busybody. Hi guys. Um, anyway, like they're very welcome here. And
Hmm.
even if they're in a bad mood and they're angry, I do not mind. Like I'll hear some hollering or something on the lobby, and I'll say, "Come on, come to my office." They will come. You know, they just do. It's like a magnet. I don't know.
Hmm.
Um, but positivity can be very infectious, you know.
Well, we know the negativity is coming because that's just part of life. It's all around us. So
It
why
is.
not invite it to yourself?
Yeah, yeah. You know, and it would be really easy to be negative here all the time because of, I hope you're feeling better, by the
Oh, I'm
way.
feeling so much better. Oh my gosh.
Um, there, you know, like I said, everybody just has such poor self-esteem
Yeah.
and they don't think much of themselves. But man, if you can just give them an ounce of positivity, just an
Hmm.
ounce of something to look at that's good about them, it's just amazing how their eyes light up and how they
Yes. Yes.
react.
Yeah,
Um,
100%. I get that all the time with people that I work with when someone's like, "Man, I haven't been out of bed in 2 weeks." And you, just by me connecting with you, you gave me the ability to go outside and just be out in the sun for 10 minutes. And I'm like,
mhm,
I'm glad I could be here for you, but you're the one that's doing it. It's not me, okay?
mhm.
This is you that's doing this, but it's so magical when you see those sparks and you see that little bit of positivity help uplift them a little bit, and
So,
know that you can continue to build on that.
yeah, and just know that I, of course, have to say this because I feel it. That guy probably putting his feet in the grass or the sunshine is probably the thing he did as a child to raise his vibration.
Exactly, exactly.
So now he knows, take off your shoes and go walk in the yard,
Yeah, yeah.
whatever it is. All right, so back to my painting.
Yeah,
Um,
well, before we do the painting, let's finish up with that. I think this is a perfect time I know that with the pre-interview, there was some talk about the 6 to 12 month period. And I want to talk about that,
oh,
about when people really feel like, hey, I'm getting sober. It's been 6 months. And then what happens in that 6 to 12 month period and how you can help try to keep them on track. And maybe if we could just discuss that a little bit.
mhm. All right, so the most dangerous time, and I'm stealing this from the doctor on Facebook or TikTok or wherever it is. The most dangerous time for in recovery is 6 to 12 months. And that's because in that 6 months, they probably have been in the clinic, they've had supportive people around them,
Hmm.
um, they're feeling good about themselves, and um, they want to wean off the medication, all right? And they want
Yeah,
to
of
do it fast. Trust me, they want
course.
to do it fast,
I
no matter
know,
what
I
I
know.
say. And I go, yeah, you're going to be in here in a week crying that you're miserable, but okay, whatever. And they do. They come back. And I go, okay, I'm not going to say I told you so, but sometimes. Um, anyway, they wean off the medication. Recovery doesn't happen in a year. You know, they didn't become a substance abuse disorder overnight, and they're not going to reverse it overnight. I tell them all the time, they say you got to be in this program for a year or two um, to really know. And I'll get into that a little bit later, but that 6 to 12 months, now they're starting to feel good, and they probably aren't coming to the clinic anymore, maybe,
Hmm.
or not as often, and um, something happens that stresses them, and then they end up using as much as they did when they quit 6 to 12 months ago, and it
Hmm.
kills them because
Hmm.
they don't have the tolerance anymore. Um, so, I have people that have been in this clinic since the day I started.
Okay.
They don't leave. Some of them are on 4 milligrams. There's 10 milligrams in a milliliter. That's like a drop because it's a liquid. But they'll say, you know, they've been here so long that they don't want to give up the accountability. They don't
Mm.
want to give up the relationships. They don't want to
Mhm.
give up the clinic. So they might be on that 4 milligrams for 6 months before they ever say, okay, try, you know, um, which warms my heart actually, because it says, they're part of us. They're part of our team. They're part of our family. And they don't want to leave because of that. I said, well, you can come back and visit, which I don't know. Once in a while, they'll reach out to me still to this day. Um, we have a tree that I painted on the wall. And every time somebody graduates our program and is successful, their patient number goes on one of those birds. So the birds are flying. Um,
Mhm.
and I try to personalize them when I can. Um, like I have a couple that just finished and they have so many body piercings. So their bird actually has a nose ring in the beak.
That's cute. That's great.
But a couple of
So
them want to paint their own, so that's
yeah.
good.
So
Yeah.
in that 6 to 12 month period, which is a very critical time for
Mhm.
your friends that you're helping and clients and family, however you want to call them, is there
Mhm.
any extra stuff that you guys try to do within that time frame to so that they have homework once a month at home or I don't know what it would be that
We
could
have we have a reconnect, and it sends out messages to the patients,
okay, I like
and
that's
the
great.
patients can message back to their counselors. So if they don't show up one day,
Okay.
we can send a message that said, "Hey, are you doing okay?" And then they'll answer. Um, so there's always something going on. Somebody's always sending them something on Recovery Connect. I use the Mend program for scheduling, so I will send out group texts or whatever
Mm-hmm.
on Mend, like a holiday greeting or a hug or whatever, and
Yeah.
it's funny how much of a response you can get just sending something silly over and over and over again.
Mm-hmm.
But they know someone thought about them. So we are always in touch with our clients, even if they only come once a month. They're getting phone calls from someone or they're getting messages from someone.
Yeah.
Um, yeah, otherwise I find that if we don't stay in touch with them, we lose them. And
Yeah.
I don't mean to death. I mean like their momentum just goes to hell, really.
Mm-hmm.
And then they relapse. So I try to keep telling them over and over and over again, I know you feel better, blah blah blah. Actually have patients out in the lobby that they'll say, "Hey, can I go down 10 milligrams?" I'll go, "No, um, that's like 10% of your dose. Do you know what you feel
Mm-hmm.
like?" And they go, "But I want to. I know I can do it." And then other patients will chime in and say, um, "Better listen to her. I thought that once too. I ended
Yeah.
up in the ER." Like, I mean, like, so they pipe in. I would never bring that up in the lobby, but the patient's the one that brought it up.
Mm-hmm.
So the other patients just chimed in and said, "No, you don't want to do that." So, um, yeah, it's very interesting to see the interaction in our clinic between staff and patients. Even people we get from other clinics are like, "This is like no other clinic I've ever been in." Like, your number in there. But some of them have 1,000 patients. Uh,
Yeah.
they have more than one provider, but
Mm-hmm.
1,000 patients. So that there's not a lot of consistency when you're dealing with that many people, I don't think.
Yeah, it
Um,
can be
I
hard.
want I want to interact with my clients. I don't want to say, "How's your dose? Okay, bye." Like
Mm-hmm.
I want to know like what's going on? I haven't seen you in a while. So I'm talking to people all the time, walking in and out of the lobby. They know me and I know them. And going to the jail and admitting them and then seeing them at the jail every 2 weeks, we have a 65% return rate to our clinic once they get out of jail. That's
Mm.
really huge. That
Yeah.
is huge in the
Well, it's
substance
because of
world.
who it's because of you and who works at the people that work at your clinic,
Right,
right?
because they know me and I'm always
Yeah.
bragging about the
Yeah.
clinic and you're gonna like this, you're gonna do this, and like I am constantly just like pumping them up when I go in there so that
Yeah.
will return because I know once they walk in the door, that's the hardest part for them. But once they walk in the door, they feel it right away. You know, patients are laughing, joking around with each other.
Mm.
It's not what you would expect. And
You-
yeah. So yeah, that's our clinic. We have a peer support who is in recovery, and so she is a great resource for those people that like, well, what did you do when? You know, like
mhm.
um, so we have her, and we are having a second one that's starting here pretty soon.
Great.
We have a case manager. We have all kinds of resources. We're always trying to get resources. No, with housing is always a problem, especially in North Dakota where you're freezing to death. Where are you out of Colorado?
Yeah, I live in Erie, Colorado, just outside of Boulder and north of Denver.
Oh, okay. Well,
And it's
well, it gets
70
as
degrees here
kind of,
right now.
oh, yeah, I'm gonna hit the heat.
I
Um,
know, right? Hey, I want to say, so back to the 6 to 12 month thing, as far as that being like a really critical time with folks. What I've experienced with the people that I've worked with, taking them through the 42-day process and teaching them to learn to love themselves again, is by really changing that vibration and learning to love themselves again. They're able to show up differently to the situations of their life instead of showing up as the same person that got them in this situation in the first place. And
yeah, like
that's
the term dry drunk,
what's that?
like the term dry drunk,
Yeah, exactly. Exactly.
you're
And
not
that's what I,
changing anything.
no, you're so miserable. Like, and that's what I talk to people about. I'm like, you're going to have to be willing to start looking at your life in a way that maybe it's time to start making some different decisions. And the way you can make those different decisions is really by writing down things that you're going to do to love yourself today, and then continue to do that for an extended length of time, which is 42 plus days. And then you're changing your vibration. And when you show up to the challenges of your life, it's a little bit easier. And then the next time, it's a little bit easier again. And then the next time, it's just part of your life and you get to do it. It doesn't dictate to you the terms, where it's choosing for you your thoughts and emotions versus you choosing your thoughts and emotions around the circumstance.
Yes, and I need to take that to heart too. I mean, like I'm constantly like, I mean, like I don't always practice what I preach. You know what I mean?
We're human
And then,
beings,
yeah, then you
humans gonna
find
still,
yourself like,
yeah.
what am I doing? Yeah. But I
But
love. Okay, so my vibration goes up just talking about vibration. My vibration goes up by seeing changes in people, like just even a
yeah,
little tiny change and the way their face lights up when you notice, you know? Like I
beautiful.
told one guy one day, I was like, oh my God, you have the most beautiful skin. Do you remember what you looked like when you came in here? Because he was using methamphetamine. So
Yeah.
it looked like he had bad acne. And he's like, oh, you like my face? I'm like, yes, I love your face. Um, so he's the one that comes in and out of my door every
Oh,
day.
okay. Yeah. Yeah.
And so then he'll come to my office and go, I like,
And that's love, man. I mean, that's him loving himself too. He does, I mean, your thoughts subconsciously and consciously, not only 90% of them that you have are not correct, you repeat them the next day. And it's this
Mhm.
constant loop that these people are stuck in over and over and over again. And what I'm teaching people is just one way to try to break them out of that. There's many different ways, I think, and I just want people to be able to find one. But that's where allowing them to be able, or them allowing themselves to receive their love and being able to show up and make a different decision instead of the same decision that's kept them where they are. And that's what I've
Like the
really,
guy that I challenged when I pissed him off, like he decided to take a different path just to show me
yeah.
that I'm wrong.
The truth
Um,
hurts. The truth
yeah,
stings like crazy, right? The truth hurts.
because I was just
So,
like,
yeah, I just wanted to just kind of put that in there. Let's talk about your art real quick. I want to be conscious of your time and then we'll wrap things up. So, why don't you tell us about your
okay.
art?
So when I was young, I used to doodle a lot, and I would like draw cartoon characters, things like that, and um, one of my teachers pointed out one time, and this kind of shows you what a difference just one little comment to somebody can make.
Yes.
Um, and that is that she said, "You are just going to be a great artist. You don't even know it yet. These are so good." And, of course, me coming from where I came from with no self-esteem and trauma, um, that I didn't really believe her, right? I didn't. And then there was a librarian. And okay, let's get back to the art. That's kind of going off case, but a librarian changed my life too with simply saying, "You are the saddest little girl I've ever seen."
Hey.
Because she noticed. Nobody else notices, or at least they don't say anything. She noticed. She made a huge change in my life. I think about her all the time.
Hmm.
Um, because some adult noticed, so just walking by. Okay, back to the painting now. I put that on the back burner, um, because life happened, right? And
Hmm.
the funny thing is that when life happens and you get busy, you take the one thing that makes you happy and increases your vibration, and everybody else's needs are more important than that. So it goes on the back burner, right? When in reality, if we do the thing that puts us in a higher vibration, those other tedious things are so much easier.
So well put.
So I,
Exactly.
I didn't do anything in color. I didn't do anything. And then I went to this corks and canvas party. So have you heard of those? Where you
Yeah, where you
follow
go and
someone and do the painting. Yeah.
okay.
So I can do this. And these pictures are ugly. So I went and bought it. I went and bought an easel and a bunch of paints, probably 7 years ago. And I did a bunch of strokes with paintbrushes and did things like angels, things like that. There's an angel on my wall here somewhere. Um, and every time I did something, it got a little better. But then again, life happens. I put it on the back burner. Um, and then when I started working with energy and vibration, and trust me, I'm not a pro. Like I just suck up every bit of information I can get and I share it. I've told the people in my group, I was like, this is not my group. I need this as much as you do. This is our group. I'm going to give
Yeah.
you information, but this is our group.
Mm.
Anyway, so then when I got into the energy and vibration, I was like, I got to paint more. I love to paint. So I make a point of painting something, touching paint, mixing paint, painting something every single day. Even if I only have 5 minutes.
Oh,
Um, because that's myself holding myself accountable to my vibration. Because all right, so to give you an example is like I had 5 minutes one day, literally, because I was doing vibration group the next day and I always cooked for them. So that got them to come to my group too. Every little trick helps. But I put plastic on the island in my kitchen and I poured a whole bunch of greens and golds and yellows in there. And I took a canvas and stuck it in there and pulled it out.
done.
It came out so beautiful. I did
I
it
bet
again.
it did. I bet it did.
And I sat and laughed. I mean, no one else was even home. I was laughing to myself. But it only proves, what you can do in no time.
Hmm.
Like, but it's kind of like going to the gym. People go to the gym, and if it's a routine and they actually like it, and they, stay true to it. But as soon as you take a break, you go on vacation or something, it's very hard to go back to the gym, right? So it's kind of the same way with working with your higher self. Like, what makes you happy? What gets up your vibration? Um, anyways, that's what I would tell anybody is I don't care if you take your shoes and socks off in the snow and just go out there and run back in, but
Hmm.
if getting in touch with the earth is what brings up your vibration, just do it. Just do it.
Yes. Yeah. And do more than one thing. Do multiple things and then see how you feel, right? Like,
Well, yeah, and that's kind of with my painting. They're all different. Like I
yeah.
keep changing everything because I want to do this and I want to try that. I want to do this. So oh my God. I have my basement storage area is my painting studio, and it's like 1,000 square feet. It's huge.
Yeah.
Um, and I have stuff everywhere. Like I never, it's like one night I think I posted something on Facebook. It's like, oh, guess it's resin night. There were 7 paintings that needed resin on them. So I had them just lined up on tables. But I was just like going down there showing all the resin that was going on in my office. So yeah, there's this and that and the other thing always going on. So and I love it. Sometimes the patient will come in and say, "Oh my God, that picture is so pretty." I go, "Okay, have it." You know,
Oh,
I
that's
don't
awesome,
care.
Georgia. I love that.
hmm
That's so great.
because it means something to them. You know what I mean?
Hmm.
And for me, it was just it gave me something. It raised my vibration. Yeah, it'd be nice to sell them once in a while, but they don't ever stick around long enough. Um, yeah, so
What's the name of your clinic?
it is Community Medical Services Minot.
And that's in Minot, North Dakota.
Yes, yes. Um, Please, everybody that knows somebody, send them in.
Yeah,
Um,
we'll definitely plug this. We'll put your website on here. Do you guys do like any social media or anything like that?
I'm sure, but you know what? I hate social media. Sorry.
Okay.
I literally only watch reels. I never read anything
No
else but
worries. Yeah.
reels.
No,
Because I think that is so negative. I just it's like watching the news. I won't do that either.
I don't
Um,
watch the news either. It's one of the best things I ever stopped doing.
yeah, but it's just so I don't know. Like um my patients that say they like music for their vibration, I go, well, what are you listening to? Are you listening to something uplifting or are you listening to some negative, I'm gonna hang myself and cut my wrist stuff? Because there's a lot
Right.
of that out there.
Yeah.
That ain't helping your vibration, honey.
No.
Like, it's like a channel, switch it off to a higher
Yeah.
vibration. That's why I love Hallmark. My husband hates it. Um, he says they all turn out the same. I go, I don't care. They're happy. And I can smile through the whole thing. Someone's not getting their head off or getting shot. Yay. So
Well, that's a
um,
man thing. That's a man thing for many
I
men.
well, I had another love story. This good, like, yeah, he's like, you know what's gonna happen? They're gonna get married and live happily ever after. I go, I don't care. Makes me happy. I don't care.
Exactly. Well, I hope you have the most amazing holiday. Merry Christmas. If there's one thing that you could leave with that speaking to someone that's in a place where they want to they're thinking about recovery, they want to get better, they know there's a possibility, what would you tell them?
I would, just from drawing it out of my head in a hurry here, I was, first of all, I would notice that they're unhappy
Yeah.
and say something,
Okay.
I would notice. Um, and then somehow, if I could, I would show them that they are a good person, that they deserve they deserve more
Mm-hmm.
than what they're living. And it's
Yeah.
possible. I've seen it happen,
Yeah.
so if you can just get their foot in the door, for most it makes a big difference, and sometimes it's 2 or 3 trips here, over 5 or 6 years, but that's okay. At
Yeah.
least they came back, they were safe enough to come back. So
Yeah.
um,
Absolutely.
yeah, so yeah, and so I would say to all the, primary care providers out there too, these are people. It was the government making pain the sixth vital sign, what, 10 years ago, that started all this.
Mhm.
And then the government said, take it all away, and nobody knew how to do it. So there's like opiates all over the place. They're accessible to everybody. And then they need them. They're not doing it to get high. They're doing it to not be sick. So,
Right.
like we kind of did this to them, people. You know, in hindsight, I'm pretty sure I made some people sick before I knew anything about opiate use disorder.
Hmm.
Before anybody knew anything about opiate use disorder, really. Um, everybody thought of it as somebody, homeless person on the street sticking a needle in their arm, Um, I have a 75-year-old patient that got 320 milligrams of oxycodone every month and then got cut in half and cut in half and cut in half, and she was so sick.
Yeah.
Um, so it's not just the homeless people. It's every
Yeah.
walk of life.
Hmm.
I've done a lot more. I've been asked to do a lot more presentations lately, and I just say I guarantee everybody in this room knows an opiate use disorder person that you
Oh
do,
yeah, no question.
and starts a lot of conversation, even at the VA where I had to explain what an opiate was.
Yeah. And
Um,
I want to tell people I was one. And I want
mhm,
people to understand that like you do not have to stay in that place. There's help out there. You can heal. There is hope. I mean,
mhm,
there's no question in my mind being free of it for over 6 years, and I have access to it every single day. And I
mhm.
would
And
never,
I
and I
hand
would,
out journals.
yeah,
I hand them out of my office. Take this journal, and just start little.
yeah, to eat that elephant one bite at a time, people, one bite at a
Uh,
time.
I actually had somebody bring their journal in with all the three things they did good that day that they wrote down every single day to show me.
Nice.
Um, so, I mean, it did something for that person. It was a powerful assignment to give that person for him to bring it back with him and show me what he did.
Yeah,
Um, Somehow, I clicked with him so that he felt comfortable in doing that, and um, it kept him busy. It was his first step, to doing it. And I say, journal, journal, journal. I journal, but I can't read it after I'm done. I should have been a doctor and not a practitioner. Um, but talk to text, nah, you got to write it down.
yeah,
And journaling is a really good way to get your vibration up. Dump everything, just dump it.
yeah, absolutely. Well,
But
Georgia, thank you so much for your time and taking the time today to be here with me. I really, really, really appreciate it.
I appreciate being invited. It's a small world when you meet like an ex-patient of mine, and here I am. It's a small world,
Yeah,
but
it really is. It really is a small world, but you are a true blessing for those people that you're working with and treating them like people, human
Mhm.
beings, right? We're all human beings. And so
Well,
and you bringing
I
that
was
love to
invited
them.
since I was invited to your site. I mean, since I was invited to the podcast, and of course, then I had to look at your site. Um, I have given your site name to several clients because you're making a huge difference by just posting something positive every
Yeah.
day.
Hmm.
You know, it's like it's like a year's worth of sunshine blowing up your ass every day. So, but I mean, like that's what they need to read, and it's not
Yeah.
like it's really wordy or lengthy. It's like
No.
it's just something. Look, you guys, look how easy this is. All you gotta do is look up at the sky. Like take a deep breath.
It really can be super simple. We way overcomplicate everything as humans, and we're so freaking hard on ourselves, and we're our worst critic, And I just want people to realize you're a human being. You do not have to treat yourself like that, and it is a choice.
I can be a very impatient person
Me too.
and a little OCD. But when I paint and it is a flop, I can laugh at myself. I mean, I literally can laugh at myself, scrape it off and start over again. So, like, I can't do that in other areas of my life. But when it comes to painting, the thing that raises my vibration, I can laugh at myself all the time.
Yeah,
And I don't even stress about it. Oh, that was a waste of 2 hours. Won't get that 2 hours back. But
yeah,
um, it's okay. I wish I could do that more in other parts of my life and something I could, you know, work on. But like I said, I'm always learning. I love to find things on those reels that I can use. Oh, that's a good point. Um, but at my age, sometimes remembering it's kind of hard.
You gotta write yourself a note to remember.
Yes, yeah, for sure. I write my notes on my door before I leave. Purse, phone. Otherwise, I'm
Yeah,
back in the site 4 or 5
yeah.
times. So I get all my steps.
Hey, that's a good way to get your steps in for sure. Well,
Well, it was
Georgia,
very nice to meet you, and thank you so much for inviting me because
my pleasure.
my counselor right before she left said, "How long is this?" I said, "It could be half hour, it could be 2 hours, depends." She goes, "This can be 2 hours because you just get too fired up about these subjects you like." So
And I
that's
would
true. I did.
totally go 2 hours with you, but I did an hour and 40 minutes before this.
Yeah, I
And
know.
and I did TikTok live for an hour and a half this morning, so I'm like, whoa.
And I have 15 people to start on still, and we closed at 1.
Oh,
So
okay, well, let's get you working.
yeah, not that I want. I'd rather do this. That's it. That's the
Yeah,
problem. I'd rather do this. Okay. Thank you so much. It was nice to meet you. If you ever want me
great to meet
back,
you.
let me know.
Yeah, I have your phone number too, so I'll send you a text, tell you happy holidays and all that. And I always tell people when we connect like this, we're friends now. If you want to be my friend, I want to be your friend, and
Oh
you
yeah,
know,
yeah. Now I can
oh.
say, hey, hey, what do I do here? What should I do
Oh
here?
yeah.
All
That sounds beautiful. Okay, Georgia,
right.
have a beautiful afternoon.
You too.
Okay,
Thanks.
bye-bye.
Bye.